Welcome all. Thank you for being here with us. Thank you for your patience as we get started a minute or two later than 2 o'clock, but we're so glad you're here with us. We think we have some really fun content today. Um, and like many of the times we've gotten together, if you've joined us, we'll be creating time for all of us to connect with one another, which is a really important part too, because we're sharing some experiences, but it's really important to have the experiences that you all have potentially shared with one another and connections you can make by joining us today. So thank you very much for being here. I'm gonna ask Kathleen if you can share your screen and we could probably get started.
Great. Thanks, Barry. Thanks, Kathleen. Good afternoon, everyone, and welcome to our June Community Health Equity Initiative Data in Action webinar. Today, we will be talking about using creative expression to visualize data and increase accessibility. And we have a couple speakers joining us today to talk about that. We're very excited. I am McCain Scharf. I am an epidemiologist with the Community Health Equity Initiative at DPH, and we'll just be doing an introduction before turning it over to Barry, and who's a regional data and action support provider with us. So happy to have you all here today. Thanks again for joining us. Next slide. As we get started, if you would just put introductions into the chat, please, with your name, organization, and pronouns, so we know who's here with us today. And as we usually do for these workshops, we will have a breakout time at the end, and we are doing it by region today. I know we've split up in different ways for different sessions, but today we're going to do it by region. So if you would click on the Mentimeter that is in the chat, or you can go to menti.com and put in the number that's at the top of the slide and indicate what region of Massachusetts you primarily serve, or you would like to chat with others in the breakout room about today. Looks like folks are starting to get in there, and Rebecca put the link again to the Mentimeter if you need it in the chat.
That's good.
All right, continue to, oh.
I did want to mention that my region is really not on here because we are Western Mass. We're Hampshire County. So I can put Pioneer Valley because we do go into Pioneer Valley, but we're really not in this list.
Apologies for that.
Thank you so much for that feedback. We're using this to kind of make the breakout rooms for later on. So knowing that, we'll certainly make a Hampshire County breakout room to make sure that you have somewhere that you and other folks who are working specifically in your area can focus on. So thank you so much for letting us know.
Okay, so you can continue to put that in if you haven't. And like Isabella said, we'll use it to sort of break out folks at the end. So here's our agenda for today. We're doing our welcome now. I will do a quick overview of the Community Health Equity Initiative and our survey, the CHES. And then we will move into our data and action focus today around using creative expression to visualize data, increase accessibility. We'll move into breakout groups for connection and discussion. We'll briefly touch on our plans for moving forward and then have a wrap up and next steps. Okay, so a little bit more comments in the chat about where people are selecting. So the DPH Community Health Equity Initiative collects data on health, economic, and community conditions in Massachusetts with a focus on residents who often experience health inequities, and we call those our communities of focus. We have two data sources, primary data sources. We have a quantitative data from our Community Health Equity Survey, which last went out in 2023, and qualitative data collected by residents who are community evaluators with the Tufts Interdisciplinary Evaluation Research Team tier. And the purpose of CHEI is to collaborate with community, state, and local partners like all of you in using data to drive funding, programming, and policy change to advance health equity. So glad to have you all here with us today. I'm going to share just a little bit more about our survey for anyone not familiar. Like I said, in 2023, we launched the Community Health Equity Survey, and it was developed in partnership with our DPH partners, as well as over 100 community partners. We collected data in the fall of 2023. It was primarily an online survey available in 11 languages and ASL, and it was open to Massachusetts residents 14 and older. We set sample goals for our communities of focus to ensure representation and sample sizes to do the analyses that we wanted to do, and over 18,000 Massachusetts residents responded to the survey. And as I said, we have communities of focus. We center communities that are often underrepresented in data systems and most impacted by health inequities, and they are listed here, including immigrants, older adults, parents and caregivers for children and youth with special healthcare needs, parents under 25, people identifying as LGBTQ+, people of color, including Asian, American Indian, Alaska Native, Asian American, Pacific Islander, Black or African American, Hispanic or Latine, and Middle Eastern North African. People whose primary language is not English, people with disabilities, pregnant people and parents of young children, rural residents, veterans, and youth and young adults age 14 to 24. Here is our survey topics. You can see our full survey on our website, but some of the areas we collect information on are demographics, safety and social context, substance use, mental health, employment, access to healthcare, basic needs, education, information sources, COVID-19 experiences, and neighborhood. And this is our data and action framework created by the Public Health Institute of Western Mass to visualize the way that we think about data and action. So in the middle of the center gear, we always center equity, voice of the community, and power sharing. And then around that center, we have gears that keep us moving towards positive change. You can enter at various places and sort of move around the circle. But we talk about sort of defining what data or what question you have, analyzing and interpreting the data, prioritizing based on the results, acting, and then evaluating. And again, that's a circular, cyclical process. It doesn't always look linear. Next slide. So I'm going to pass it over to Barry Keppard, who will take it away. Thanks, Barry.
Okay. So we're here today with this focus on a creative expression to visualize data and increase accessibility. We're bringing this topic, and I think this is probably something most people appreciate, how important data can be. Gives us information, provides us direction. However, I know an issue I run into, you may run into as well too, is that if people can't really access the data or even seeing the data, not necessarily being able to kind of fully understand it, that part of it, we miss out on opportunities. And so in a really nice way, we're joined by some folks today too, who can give us some examples of what that's looked like in their work, and hopefully kind of serve as a bit of an inspiration for some conversations today, but maybe be helpful to you in your work as you think about kind of sharing data and information with folks that you may know. So I'll go to the next slide. And so really, again, we're going to ask this question, and hopefully it can be something for you to engage with today too. Like, how might we continue to expand opportunities by which we kind of visualize data and think about increasing access? And so we'll share those examples with you today. And what you can see on the screen here are just ways to think about presenting information and data differently on the left, kind of in different ways to visualize it. And then on the right, the way kind of arts can be a mechanism to bring that information to greater audiences and really have a kind of a cultural resonance with the work as well too. With that, I think I'm going to hand it over to our first presenter, Tran, and then we'll go to Keleigh for the second presentation before we go to breakouts and small group discussions too. So handing it over to you, Tran.
Wonderful. Thank you so much, Barry. Thank you, MAPC, for this invitation. I'm really honored to be here today. There's a lot happening in our world these days, and so this topic becomes even more important, especially during this time as an artist and as a cultural worker. So my name is Ngoc Tran Vu. I go by Tran, and I identify as a 1.5 generation Vietnamese American artist and cultural organizer based in Boston's Dorchester community. My work is rooted in storytelling, healing, and social justice, often through the visual arts, community engagement, and public installation. So I'm going to show a video right now that talks more about my work, and then I'm going to delve into some specific projects. So I'm going to share my screen. Okay. I think everyone can see this okay. I'm going to play. For me, the arts is a way to bring people together, to spark conversation, and to create spaces for healing and hope. The world as it is so reflective of our histories, policy work, and people who are at the table and who are not. And so thinking about initiating change through the arts and culture is so important, and it's a part of my calling, utilizing the arts to engage people and to bring them into the conversation and the fold. My name is Ngoc Tran Vu, and my business is Tran Vu Arts. I create a variety of multimedia using painting, drawing, photography, and really thinking about installation, public art that really engages with the community wherever I'm at. My work is so informed by both my lived experience and also my framing of the world through a social justice lens. The intentional message and also the material, the colors that's used, the texture, how does this translate? Every project is different. There's not a starting point, but it's like I feel like I'm constantly kind of in conversation and just observing the world, being really immersed in pop culture and what's happening. It's really reflective of the narrative that I'm surrounded by. I really think about my art as a practice that engages community stories, past, present, and future.
I was born in Vietnam, and my family and I came to the US when I was 4 as political refugees. And we grew up in the Boston neighborhoods, coming from a working class backgrounds, thinking about my community members who don't have access to certain opportunity and resources. So when I do my artwork, I'm really mindful of the lived experience of my family and also wanting to advocate for change. Some of the social issue that I've been working on for years now has been around housing work, displacement work, the legacy of war, the legacy of memories, and how that still remains individual that have been affected through migrations, displacement, by trauma. Some of my works have lived on community walls of a neighborhood restaurants, in public spaces, public art that really engages with the community wherever I'm at. I also teach as an educator. I lead workshops. I offer commissions. I also consult. So I also work with different cultural and arts organizations throughout the US and also throughout the world too. The arts and culture is such a beautiful way to both reflect the times that we're living in, to reflect the issues that we're grappling with, to provide path for healing, for unity, for hope, and for transformations.
So with that, I just want to say that I believe that the arts is a powerful tools to really to surface truth, to shift narrative, and to move people emotionally, especially when it comes to complex issues such as health equity. And oftentimes, data, as we know, can live in charts and PDF, but we know that numbers don't always tell the full story. And I feel like that's where artists and cultural workers can come in. Through community-based art, we can help interpret and represent data in ways that are more accessible, visual, and emotionally resonant. I think this invites people, especially those who are the most impacted, to engage, reflect, and respond. So with that, I also want to share a couple projects, especially during the pandemic that I collaborate with MAPC on. Let's see. So this was a project during the pandemic, and I was thinking about different ways to engage my direct communities through kind of some of the survey work, but in really advocating for community members to get vaccinated, to really you do that in a visual way. And so I was thinking about really cultural resonance, things that can really speaks directly to families and individuals. So here, using Vietnamese local languages to really translate that. And so I was thinking about some of the stickers, and so this is a way to say like, oh, we just got vaccinated, but and juxtaposed on a conical hat. Also doing using postcards, but postages that can really represent, especially families writing to one another in kind of distant spaces, but really resonant with some of the experience that they have been through, especially in kind of migration. So using kind of that framework of that. Other things to engage as crossword kind of word search ways that people can feel like they can be a part of things that are happening, and especially with protests that are happening at the ground level, really also utilizing that as a way to showcase this is something that our communities are really behind. There's another along with that, another set of projects was also one second. Yeah, and thinking again, the visual kind of representation of seeing, people in their own communities themselves, and so again, really, juxtaposing that with so much visuals that we see on a daily basis, and so how do we make it so that people can see themselves in it? And then thinking about different forms of narrative kind of storytelling, whether it's on a bus, whether it's on a bus stop, kind of in our community, seeing that as a way that different kind of outcome that can come, especially kind of coping kind of with COVID, and it's just living in the pandemic, just different things that can come up, such as stress, such as mental health. These are ways, and using kind of the visual and the images to invite people into that conversation. Other things, quarantine bingo, thinking about ways that people are engaging kind of either at home or outside of the home, ways that people feel like they can be again be a part of the conversation. So kind of the quarantine bingo, and I had that also translated into Vietnamese and also local languages as well. So this was a project that I was thinking again with kind of like visual representation that can really be translated kind of across culture, across communities, and thinking about ways that people can engage with it. Other projects, just to give you, just like an overview, some of the things that I mentioned, working on in public art, that was something that came out, especially during the pandemic, I think, in a more noticeable way, especially language with spatial justice, thinking about kind of the public realm, who gets to be kind of in public spaces. Is there a certain type of, again, narrative and stories that are oftentimes, represented, and then those who are not. And so some of the projects, and this was even before the pandemic, but in recent years in thinking about public art, this is a mural project that I embedded with my direct community again. And through a series of months, we were able to bring together different groups, an advisory committee to represent our neighborhood that really represents local voices. And through a series of trainings, especially around trust building, we were able to really hone in on the specific theme that we wanted the art to come out, and so that when we have visitors come by, they can really understand kind of both the cultural narrative and seeing themselves in ways that can really activate local talents, local kind of voices to be a part of the public art that we see on a regular basis. And so again, through like series of on the ground, making sure that we selected themes that really resonated with our community, that went through kind of different kind of iteration and drafts. We made sure that that was something that the communities wanted to be a part of, and also to ensure kind of equity in voices and representation. But this was something that we were all super proud of. Still looking back on it, is on a permanent kind of mural on a restaurant right here in Dorchester, in Boston. And so that's something that the community is super proud of. At the end, we had like a block party to showcase kind of the voices that was a part of this mural making. And then quickly, another mural that I was also a part of, and this was in recent years too, was working with a local pantry with the city of Boston, and really activating, and really showcasing that there is a local pantry here. We invite community members every Tuesday, and around this idea of did you eat yet? Oftentimes in respective community, in Asian community, that's how we showcase care through the question of did you eat yet? And so being able to kind of use around that sentiment, that term, having that translated into Spanish, into Haitian Creole, into Portuguese, and really thinking about the engagement of that, and really showcasing different kind of families and coming together, and all within, again, a series of engaging local participant and how they think about food and think about food systems, and then embedding that on the wall so people see that regularly. Yeah. So these are the few projects I wanted to showcase. I think these projects really become bridges in terms of between disseminating kind of information, emotions, kind of really storytelling that really can spark really a lot of queries around systems and that we're living in, and the narrative and the information that are being disseminated. And so these works of art, culture can ask us to pause, to feel, and to imagine how we can really come together and really think about change on a collective basis. And so, part of my practice is in really collaboration with communities, with partners, different folks on different kind of systemic levels, and then really thinking about how really the arts and creativity can help activate data with intention, care and in a cultural context. And so, yeah, this is the kind of thing that I oftentimes, especially during these days when there's a lot of shifts happening, and what does it mean for us to access data and to utilize that in a way that can really translate in an accessible and an inclusive way. Yeah, that's.
Thank you. Thank you, Tran. I just really want to lift up that piece too that you noted about like not only is it like is accessibility, but it might provoke people to ask the question, like, is there information about this? Can I find data about this? Right. So just provoking the questions as much as it's finding it. Thank you so much. I'm now going to transition us over to Keleigh, who's going to share about a bit about her approach and the way she kind of goes about helping kind of visualize and essentially make data more accessible. Thanks, Keleigh.
Good afternoon, and thanks for having me. Let me just share my screen. Can you all see my comic? Okay, so that's a hard act to follow. Shan's art was beautiful, and I'm definitely going to be talking about a different approach. I wanted to open with this comic from Chris Lissy that I feel really resonates with me in my daily work. So it's a person sitting at their laptop, thinking, this is the perfect length for a useless report. Short enough to be missing important information, but just long enough to stop most people from reading it. And I think in my day-to-day life, and perhaps yours, we're balancing this, trying to make things brief and accessible and appealing, but then also providing enough context and nuance, like to do justice to the data, to give the data, to talk about the data responsibly, to include all the qualifiers and limitations and things that we want to. So in the struggle, another comic from Chris Lissy, you can tell I'm a fan. Here he pictures a long, boring report, which I'm sure you're familiar with seeing many of. So we could either spend our time trying to make a slightly less boring visual report that trying to appeal to more people, or what if we just accepted the long, boring report and spent our time making other products that appeal to all different types of people, like social media imagery, or maybe a mural or a sculpture or an infographic. So his case is that it's the same amount of energy, so why not direct it that way? And I think I'm with him. People consume things in so many different ways, so I think it's a good approach to present information in multiple ways. So before I dive into a few different ways that we have shared data, I feel like I'd be remiss to not mention that as you're sitting down to produce something, it's really important to think about the purpose of what you're doing. Like, what's your end goal? What are you trying to achieve? Are you trying to increase awareness? Are you trying to compel someone to do something? Are you trying to get your legislator to vote in a certain way? And then you also want to consider your audience. Who are you trying to reach? Because your audience, you'll have different asks for them depending on who they are. We all have different levels of power and influence. So that helps define, what your call to action is in your work and how best to approach it. So we could have probably multiple webinars just diving into that. But for now, I'm going to leave it at that. And maybe in a future one, we could dig deeper. So I know that this is probably going to look tiny, and my goal isn't for you to be able to read everything on this page, but merely to convey that we've used a lot of different methods to share data. Once again, people consume information in different ways. Even people in the same audience or group or whatever, are going to take it in differently. We all have individual differences and preferences. So we've tried things like comics for storytelling, more traditional infographics. This is what we like to call a data bite that's more focusing on a single statistic. We've done videos to try to appeal to some people. And then sometimes like slides work for some groups. And we've definitely been asked to create slides as products, and that is the preferred mode. So you really have to think about the setting. And I would recommend trying things out, testing them, and then talking to people to figure out if it's working or not. Is it resonating with people? Can people understand what it's saying? And it's just this continuous process of trying to improve over time and keep up with people's like changing needs and how they consume information. So I also wanted to mention that you don't really need a massive budget to do this. We don't have an in-house graphic designer. We use Canva a lot. There are a lot of templates on there. If you use a template, I do recommend you change it a little so you don't end up with a poster that looks like someone else's like garage sale poster when you're trying to talk about a health issue. But there's a lot of good information out there, starting points to work from. Okay. So this is one of the products that we created about CHEI data. It's more of a traditional infographic. And I have heard from some graphic designers that it is quite busy. If you saw what it started as, you might be impressed with how not busy it is comparatively. But our main goal of this was to sort of share CHEI findings just in general, and then increase awareness about CHEI. We ended up landing on this topic about loneliness because there was just a lot of momentum in the region about mental health and loneliness and social connection. So we wanted to align with that momentum and contribute something that could perhaps help with the work going on. So a couple things I wanted to point out that we think about when we're creating things. Imagery. So imagery can be really helpful because it can break up like a wall of text, can add some interest, but it also is helpful for just reinforcing an idea or sharing information. So in this case, this map of Massachusetts with the dotted lines like zeroing in on Western Massachusetts, it's just reinforcing that the data to follow is on Western Massachusetts. We wanted to make sure like we were clear about the population of focus in this. And then obviously you can have decorative elements that maybe don't have meaning, but are just fun to look at. Visualizing data. This is important for helping people understand it. I think oftentimes we see a statistic alone and we glaze over. It's meaningless. It's hard to sort of like make it concrete. So even like a graph, which maybe isn't the most exciting way to visualize data, or I forget what this is called, an icon. I'll go back to you on the name, but we used icons to illustrate the number of, or the percentage of people in this age group who were experiencing loneliness, basically. We could also do a whole nother webinar just about like best practices in visualizing data. But we'll save that for another time also. What else? So we included this why does it matter section. People don't necessarily make the connection between loneliness and health. And this is true with a lot of other topics we're looking at. And sometimes you need to bridge that gap for them so people know, like, why does it even matter? Why are we talking about this? Why should I care? And this helps people move towards action and solutions. We included this section about what we can do as individuals. Sometimes when we talk about asset framing, we really are talking about focusing on solutions. not just lifting up like all the great parts of the community in the beginning of our report, right? It's focusing on the things that we can do to help address an issue. The last thing you want to do when you're out sharing data or trying to compel someone to act is leave them feeling sad and hopeless. And sometimes, like if you were to present a stat on its own, it can have that effect. And then you aren't going to see much action from that. We want to empower people, not depress them. In this one, we included sort of a call to action to various like community organizations, health, care. It's a pretty broad call to action, and directing people to other resources on what they can do to help play a role and solve this issue together. Lastly, it's always good to cite your work. Some of us data nerds want to go and like look at the methods of whatever study you're citing, or dig into it to see what else it means, or brings more questions. So it takes up space, but I think it's important to somehow incorporate. To Tran's point, I believe she mentioned this. People really do remember stories more than statistics. And this isn't like a classical narrative, but people will walk away at least with the overall message that loneliness has been on the rise. And if you could find ways to integrate stories of people into this, it'll stick even more. All right, and then this is the last example I'm going to walk through. This is what we're calling data bite. And even like a few years ago when we were creating things like this, our process has evolved, including more context to make sure people don't jump to conclusions or leave like feeling hopeless. So the goals of this were pretty similar to that previous infographic. It was to share findings. We wanted to send people to the GPH's housing report once it comes out, and then inspire other people to use the data. The data's there, maybe like there's something there that can help you with your work. So here we open with a shared value. Everyone deserves safe, stable, and healthy home. So this strategy of opening with a shared value is helpful with more contentious issues, polarizing issues where like someone might shut down immediately, like if you're starting to talk about vaccines or something. Like the gateway is usually finding that common value that we could all agree on and then working our way there. This isn't really a contentious issue, but it still sort of grounds the data. Here, we did another icon thing with little houses to show that nearly 4 in 10 adults with steady housing reported issues in their home. And then the top issues: pests, mold, water leaks, noise. You might notice that we didn't choose a stat that was highlighting inequities between different populations. And part of that is because we didn't feel like we had enough space to provide the proper context. People will take data without context and sort of fit it into their own worldview, which could be harmful and perpetuate some of the narratives that we don't want to perpetuate. So that is one of the reasons we went that direction. And then here's sort of our so what, like, okay, houses have issues. Like, why does that matter? It impacts our health. May seem obvious to some of you, maybe not so obvious to others. And then we don't want to leave people just like hopeless, helpless. Now what? So we included sort of 2 calls to action. One, for people who need resources to address like issues in their housing. And then the other for the data people who are like, oh, I'm just hungry for more data. Give me data. So this is a draft. We haven't rolled it out yet. So if you have any feedback, I'm open to it. And I think I'm going to end it there. This is my contact information. Feel free to reach out if you want to talk about data visualization. And now I'm going to pass it back to Barry.
Thanks, Kelly. And thanks for the presentation, both for like what the results can look like, but how important that process can be in developing and getting to that message. So I'm going to turn it over to Kathleen.
Thanks, Barry. So I'm Kathleen Zegda. I'm with the Public Health Institute of Western Mass. We're one of the regional data and action providers. And it was really great to hear from Tran about your process, your creative process. And it's always good to hear from Kelly, who is our Senior Manager of Communications at the Public Health Institute. So now we're going to move into breakout rooms. And I am sharing on screen now the prompts to consider. And so I think for me, it was really inspiring and thinking about ideas and ways, some of what Tran shared. And then I'm grateful we get to work with Kelly on a regular basis, and it's always giving me ideas for how to think about sharing data and contextualizing. So some prompts to consider in your breakout rooms. What are creative ways you have tried to visualize or share data? Is there a data related visualization or artistic expression you've seen that has resonated with you? What would be helpful to support your efforts for creative communication or visualization of data important to your work and community? And so we're going to have breakout rooms that are going to be by region. And we have a slide here that shows how to get to the breakout rooms that Isabella has created. And I think in a second, they will be opened up and people can choose the breakout room. Isabella?
Yes, I just opened up the breakout rooms. You should be getting a little pop-up. And if not, then you can either message in the chat and I can move you to a breakout room manually, or you can go to the three little dots and then move yourself over to a breakout room.
And we'll have 10 minutes for the breakout room. So we'll go to 2:55.
And thank you, Kathleen.
Welcome back as everyone is joining us from breakouts. Okay, so some really good discussion as people are thinking about ways they can incorporate this into their work and make data or public health messaging more accessible and resonate with people. So I am going to share, there's some resources that people can follow up with. And again, the slides will be shared out. So making it public from the MAPC website, Arts and Planning Toolkit, Data Therapy and Data Murals, and public profit dabbling in the data. And I'm sure there's others that people are aware of as well. So we are, I am going to stop sharing as we wrap this up. And so thank you, Isabella, for sharing the link to the Community Health Equity Initiative data. And on the website, you can access data that is available on the data dashboard, information about the survey, and then also request some assistance for data and action and using the data. And so, as I mentioned, us at the Public Health Institute of Western Massachusetts, and then also Barry and the team at the Metropolitan Area Planning Commission can help support using the data. And I will turn it to Isabel and McCain as to close us out, and also as we're thinking about our next steps in this work.
Thanks, Kathleen, and thank you to our presenters, Tran and Keleigh, for sharing your work and your processes. I really appreciate it. We are at the end of a funding cycle and wanted to acknowledge that and just the ongoing uncertainty that many of us are feeling and living through. We are working as a team here at CHEI to make plans for moving forward and continuing on with the workshop series and our other data and action work. And as soon as we have more information about what that looks like, we will share. But yeah, just, we are in hard, trying times, and good to continue to be in partnership and come together to share resources. We are still here, still available to provide data. And as soon as we have more information about sort of what comes next, we will share with our partners and continue to be really grateful for everyone who's continued to engage and share their knowledge and access our resources and be with us in the Community Health Equity Initiative. So thank you all, and more to come.
So much, everyone. Like McCain mentioned, we will be sharing the slides. So look out for an email from me with both the recording as well as some of the slide deck and some links to our website, the infographics, and again, ways to contact us if you want to talk about how you can apply what you learned today to your own work. Thanks so much, everybody. Have a wonderful afternoon.